Hello and welcome to your final session of Dementia Awareness Level 2 with Plato training. So if you've got to this point, this will be, as I say, your final session of learning with us. So we hope that you've enjoyed the course so far and we hope that you get to finish it by completing this work. So today's session we're concentrating on Unit 2, the person-centered approach, and this is part 2 following on from yesterday's lesson. Your aims and objectives for today are to understand the role of others in the support of individuals with dementia and to know when to refer to others for help when caring for people with dementia. As always, keep an eye out for those green boxes that can help you to see which question number the slide is relating to. I will say that the right way around one day. So, the role of others in the support of people with dementia. So there are different people who have different roles, professional roles, that can be involved in the support of people with dementia. So not everybody will be directly involved with every person who has dementia, but every person who has dementia is likely to have a team of professionals around them who are able to offer support. So again, thinking back to person-centered care yesterday, we're not going to treat everybody exactly the same as one another. Some people may have similar support packages, but some people could have very different support packages in place. So we're going to have a look at the multidisciplinary team. So within that team, we have care and support workers, social workers, so people who are qualified in social work, nurses, doctors such as GPs, occupational therapists, physiotherapists and dietitians, and we'll have a look at what these people do as part of their role. So the care and support worker, to begin with, they can help with things like personal care, washing, dressing. They could also do things in people's homes such as change bedding, help them with laundry and help with meals. Care and support workers work in people's own homes and in residential care homes. Service users may need a social care worker at home because they've just come out of hospital and are recovering. Or it might be that the dementia has reached such a stage where people need the extra bit of help. When I was a care and support worker, I remember helping to set up a sort of care scheme for a couple who both had dementia. They'd both just been in hospital for a short period, and whilst in hospital it was identified that to allow them to go back to their home they would need a care and support package in place. So it was my role to sort of get that started really and identify ways of doing things. So what was going to be done was identified by sort of my senior, and how it was going to be done was sort of identified by me. What had happened was they were both admitted to hospital because they were both living at home without care and support of care workers coming in, very much reliant on informal carers, family members, neighbours. They did have two sons, but their sons both lived in Canada, so the support wasn't directly there from their sons. What had happened was the gentleman had gone into the kitchen to make a cup of tea for him and his wife. He'd put the kettle on and he'd gone back into the sitting room and he'd closed the door to stop the drafts. And both of them had hearing impairments as well, and the neighbours heard the smoke alarms, smoke detectors going off, you know, the loud beeping noise going off, but neither of the people had sort of been alerted to that sound. So the neighbour managed to gain entry. The kitchen was on fire. What the husband had done is he had put the kettle onto the stove, but it was a normal electric kettle, but he'd obviously gone back in time and remembered when he used to put the kettle on the stove, as traditionally people did, and obviously it set on fire. So they both got out okay, they were okay, they just had a bit of a short stay in hospital just to monitor them. So yeah, that's why it was deemed unsafe for them to go back home. So you can see there why people may need that bit of extra help and support as their dementia progresses. So care and support workers can be known by lots of different names. So you might hear people being called care workers, home care workers, domiciliary care workers, home helps, personal assistants. In care homes, they're generally called care workers, but it doesn't mean that your title might be support worker. But either way, it's a very similar job, and the job descriptions will be very similar in what a person is doing. And the support plan should outline what jobs or tasks are needed and who will carry them out. So whether they call them the care worker, the support worker or the personal assistant, it will be outlined in the person's care plan what that person's job is. A social worker is different to a social care worker or a care and support worker like we just looked at. So social workers are professionals and they've been to university, they've done lots of practice placements, they'll have studied for 3 years for this. So they're specifically trained to assess a person's needs and they're able to give advice on what services are best to suit them. So social workers can help if the service user needs to talk things through if they're not sure what they want. They can also be referred to as care managers because they can work in social services, hospitals or care homes. Social workers can also help with funding support and they are the primary contact for requesting continuing care funding. So if somebody doesn't have any savings or assets for the care that they require, then funding can be provided, but it'll be the social workers that arrange this. We're going to look at nurses next, and I've split this into 4 categories. So we're going to look at community mental health nurses, district or community nurses, practice nurses and admiral nurses. So firstly, let's take a look at community mental health nurses. So community mental health nurses can also be known as community psychiatric nurses. They provide treatment, care and support for people with mental health problems and people with dementia. They can assess a service user at home and they can advise of different ways of helping someone with their health and quality of life. They don't generally carry out normal nursing tasks such as changing bandages, dressing wounds and things like that. They're there to focus on the mental health problem. District or community nurses, so they've got extra training. So generally speaking, these people will be registered as a general nurse, an adult nurse, and then they'll do an extra course for perhaps 1 or 2 years to care for people in their own homes. They're members of the primary care team and they're usually based in a GP surgery or a community health centre. District or community nurses, these are the ones that are going to help with those things that we said the mental health nurses don't help with, such as dressing wounds, changing bandages, and helping with the medications as well. Practice nurses, so these are also based within GP surgeries, but they are different to those community and district nurses that we just looked at because practice nurses stay within that GP practice. So they work alongside the GPs and they work alongside those community nurses, but they stay indoors, if you like. So they carry out different activities such as giving flu jabs. There's lots of flu jabs going on at this time of year. As I'm recording this, it's October. They can help with checkups, they can help with contraceptions and smear tests and all sorts of different things. Most GP surgeries do have practice nurses. They can carry out general treatments such as dressing wounds, giving injections like we said, but again, rather than doing this in a community in a community setting such as the person's home, it'll be carried out inside of that GP practice. So if people can get to the practice, obviously the nurses can see more people because there's less travel time and things for them. Practice nurses can also help to run clinics such as asthma, heart disease, smoking cessation is another one. And they'll also look after patients with long-term illnesses like diabetes, epilepsy, etc. Now, Admiral nurses, this wasn't something that I'd heard of until I started teaching the dementia course. So this was new to me. Admiral nurses are nurses who specialise in dementia care, and they can support the service user as well as the carer. So again, Admiral nurses are a qualified nurse who has specialised in dementia care, and they get the new title of Admiral nurse. So what they're employed to do is to work with people and their families of anybody who has got a diagnosis of dementia. They can help to teach the families and the service user new communication methods and techniques. They can give reassurance and find good ways of managing things like fear, distress, perhaps when the informal carers are finding it very difficult to find a method of what to do. They can also give professional support to those unpaid carers, and they can recommend people to come in as a professional support, such as a paid carer. They can try and get, if you've just got a service user and the informal carers, and as that dementia is getting sort of harder and harder to manage in the home, perhaps that informal carer needs that extra bit of support from somebody paid to perhaps come in and do the personal care, just to take that element away from them, just so that they've still got very much playing a strong role within the household, but they've not got everything to do. So an Admiral nurse can help with that as well. So doctors, general practitioners, or GP for short. So GPs, we have probably all seen a GP, hopefully. The first port of call for any concerns of any health issues that we may have. They can also help look after long-term conditions like diabetes. They can help with things like depression as well by referring on to health professionals, specialists, community nurses, etc. If somebody has a particular health need, the GP is the first port of call, like I said, and they will refer the person, or yourself if it's you're thinking of, to the right service. So perhaps it's somebody requiring counselling, they can refer to a counsellor. Perhaps it's somebody requiring a blood test, they can refer somebody for that. Perhaps it's a gynecology problem, they can refer people to the gynecology specialists in a hospital. They will make suggestions on what services could be helpful for the service user, and the GP is available mostly at the surgery, but they do sometimes do home visits if they're needed. What's happening at the moment with COVID is that most of us are having telephone consultations in the first instance. Not every GP is working exactly the same, but that is what mine are doing. Not sure about home visits at the moment. Mine's only go to the surgery as and when required, so I imagine that doctors are still going out to places like care homes and things because they would need to see the service users, but other than that I'm not sure about sort of private home visits. Occupational therapists, so these are often referred to as OTs, so if somebody says, oh, we need to see the OT, they'll mean occupational therapist. So occupational therapists can advise people on how to maintain skills in their life, such as making a cup of tea, and how to live as independently as possible in their own homes by suggesting different equipment and adaptations for their home. So it could be something like having a seat put in the shower so that when they're in there they can take a little break. It could be a handrail going down the other side of the stairs opposite the banister, just for a bit more stability. Occupational therapists also have quite the fun job really of being able to advise on different assistive technology, sort of gadgets if you like. So one of the most common ones is the necklace that people wear with the button inside, because what they're used for is if a person has a fall at home, perhaps they live on their own, they can press that button and it'll make a call to their nearest and dearest, whoever that is, their next of kin. Technology advances means that there is a lot more gadgets available. So there are things like locator devices, so like trackers, automatic pill dispensers so that people cannot accidentally forget to take or overtake their medication. Things like Amazon Alexa can come in useful as well. Robotics, so things like automatic vacuum cleaners, that's going to help somebody live as independently as possible because it'll do the work for them. Different clocks, calendars, there's fall sensors, automatic lights, so when they walk in the room they don't have to switch the light on. Special plugs for the bath with a water level sensor built in so that the bath will drain if it's going to get too full and overflow. Physiotherapists, so these are there to advise on exercise and moving around, so they can help to advise carers of ways of helping somebody to move around safely. They're there to provide exercises, so such as if somebody sprained their wrist, they would advise on how to keep that sort of active to help to repair those muscles. Physiotherapists work in different places, so they could work at hospitals. They sometimes based at GP surgeries. I've been to see a physiotherapist at like a sort of local community setting as well. They do home visits as well. Again, with COVID, I'm not sure what's happening with that. The GP can arrange appointments for the physiotherapist by referring the service user to them. A speech and language therapist. So the job of a speech and language therapist is to advise the service user or their caregiver on ways of communicating effectively. So speech and language therapists also focus on the muscles in the face, so they can prescribe different exercises. Speech and language therapists also help people to cope with any swallowing difficulties. So if you're working with somebody with dementia who has also had a stroke, they may need some help with their swallowing, such as having thicker fluids, because water and liquids are the hardest thing to swallow. Again, it'll be the GP that refer people to the speech and language therapy team. A dietitian, so I think the word diet in here gives it away, so it's to do with food, and it's a dietitian's job is to give advice about what to eat. So dietitians work with people for various reasons. It could be that somebody's completely lost their appetite, they've gone off food. It could be unexplained weight loss. It could be weight gain. They can give different advice and guidance on vitamins and food supplements. So they often prescribe something called Ensure drinks, which are like sort of little milkshakes, a little bit like having a protein shake, I guess. They're full of different supplements inside. They're very high calorie for a very small amount of liquid, so it's quite easy to help somebody to gain weight by giving them these Ensure drinks. A GP again can organise the referral for the dietitian. And again, dietitians work in different places, so such as health centres and hospitals, and they work them into homes. Again, with COVID, I'm not entirely sure what's going to be happening with that either. Be interesting to see which services of these have been pulled, because it's not something I'd really considered that COVID was having an impact on. But it's a hard question to sort of research, because when I tried, it just kept coming up with differences, such as different places around the country having different protocols and rules. So the role of professionals who support dementia. When you are answering question 1, you need to describe the role of 3 professionals who work with people with dementia. So although I've given you an outline of what these people do, you may wish to do some more research on the roles that you're going to explore, because you're just going to choose 3. You could look at some different roles, which I've not given you any information on, such as psychologist, consultant specialist, a pharmacist, or a dementia care advisor. So I want you to describe the roles of at least 3 others in the care and support of people with dementia. To describe, please make sure you're using 3 paragraphs of around 3 sentences each. So I would say around 3 sentences per roles that you've chosen, and show how they can help to care and support those individuals with dementia. Now we're going to look at making referrals. So we've talked a lot already about making referrals, and I've talked about how the GP can make referrals, but let's have a little bit more of a look into this. So your role in supporting somebody with dementia is vital, and it covers many of the service user's needs, but you can't do everything, and you'll need to gain access to professionals who have got a high level of training and expertise for some areas of work. So a couple of examples here. If a service user has mobility problems as a result of their dementia, a physiotherapist will prescribe appropriate exercises. Then your job as the care worker is then to assist the person with dementia to do the exercises that have been given by the physiotherapist. So how are we going to access this support? We need to make a referral. So make a referral to gain the right support for somebody is part of your duty of care as a professional. You need to recognise when and how to do this. Think about those 2 words, when and how, because that's going to help you to answer your question. So to make a referral, you're going to need to contact the GP or the social worker. The GP and the social worker are the professionals that are able to contact the relevant professionals that are needed to arrange for an assessment to happen. So let's have a look again at how to make a referral and how to access support. So let's think back to the physiotherapy example. So step 1 is you need to identify the problem. So the problem that we've got in this scenario is the service user is having difficulty with their mobility because that part of their brain has now been affected by dementia. So we know we need to contact a physiotherapist. Step 2 is think about how you are going to refer. So because we're not able to directly do this, we can't just, as a care worker, we can't just ring up the physiotherapist and say, can I see you next week? That's not going to happen. Instead, we need to access the physiotherapy via the GP. So we need to arrange an appointment with the GP. The GP will then refer the service user to the appropriate service, in this case the physiotherapist, and the physiotherapist will then make the assessment and prescribe those exercises. Then back to you as the care worker, you would then need to support the service user to do the exercises that the physiotherapist has prescribed. So when we're thinking about answering question 2, you need to think about showing that you understand both who to refer to and how to do it. So always think about these 2 steps. So step 1, you need to identify the problem. By identifying the problem, you then need to think about who this problem needs referring to. And you can look back at those slides that we had on previously for question 1. Step 2, you need to think about how to refer. So you're always going to go via the GP or the social worker. So you need to give 3 examples of who to refer to and how. So for each referral, you need to show that you understand that you, as the care worker, cannot refer, so it's not going to be you that's ringing up the physiotherapists or the dietitians, and instead you need to show who does, and you need to do this for each example. So for example, you could have Mrs. Smith has stopped eating, she's losing weight, we need her to see a dietitian. And then step 2, how are you going to refer this on? I will speak to the social worker and ask her to arrange a referral for the dietitian. Another example could be step 1, identifying the problem. John is living in his own home and he's stopped taking his medication. Step 2, no, back to step 1. So John is at home and he's stopped taking his medication. Who we're going to refer that to? We are going to refer that to the community nurses, but we can't do that ourselves, so we need to think step 2, how are we going to get that done? We're going to go via the GP, tell the GP that he's stopped taking his medication, we think he needs support via a community nurse who can help to give him his medication. So now you can answer the final question, explain using at least 3 examples when it may be necessary to refer to others when supporting individuals with dementia, and explain how to access this support. So remember to answer this question in both parts, so you need to say when it is necessary to refer and how you're going to do that. And I've given you an example format, so such as it may be necessary to refer to others when supporting individuals with dementia because, and then you need to give me a problem and who to refer to. They can help the person with dementia by, such as, a physiotherapist, they can help the person with dementia by prescribing exercises. To refer someone to the physiotherapist, I would contact the GP. Okay, so now you should be at the end of your work booklet, so congratulations on getting that last piece of work completed, well done, and you should now have completed your aims and objectives for today's session, which were to understand the role of others in the support of individuals with dementia and to know when to refer to others for help when caring for people with dementia.